everybody. I'm Nina Crowley, Stica's Professional Affiliations and Education Manager, and I'm delighted to be here today with Liz Paul, one of my friends and colleagues from the Obesity Action Coalition. And we are both going to be speaking at the Obesity Medicine Association's meeting in April in New York City. And I really wanted to talk to Liz about kind of a sneak peek on your talk, because I'm excited that you're doing a talk at all. I'm excited that they have patient experience on the menu at the meeting, but also that it's a keynote and you're kicking off the day. So thanks for joining me, and let me know what we can, what we can learn about you a little bit now to be a sneak peek for the meeting.
Well, thanks, Nina. This is so exciting. I'm really honored to be going to the OMA conference in New York. It was crazy to get invited to speak. I didn't even know I was the keynote until it came out. I just thought I was one of the speaking sessions, and here I am being asked to keynote. And it's so great of them to put a patient voice in that important role. We recognize more and more that patient voices in the world of obesity is so critical. So my talk is actually going to be on internalized weight bias. So we recognize that the weight bias and weight discrimination and stigma is something that happens all around society. You know, you see it in the media, you see it in the doctor's office, you see it all over, right? And the thing is, we learn to internalize it too. And so my talk is going to be focusing on my own story, living with obesity. I've lived with it my whole life, but it's been really an up and down journey, not only with my weight, but also with the mental health side of things, and learning to treat myself kindly and to unpack the internalized weight bias that I have learned from society, that I've learned from bullies and doctors and parents and all sorts of people, and to rewrite my narrative when it comes to stigma and bias. And, you know, I've learned that people who live with obesity, they really have two battles they're fighting. They're fighting the battle with their health and weight, but they also have a battle that lives in their head. And it's that internalized dialogue around food, around their bodies, around what society tells them they should or shouldn't do. And that can really be a barrier to seeking care, to being successful in care. And so my talk is really going to address that from a patient perspective, and hopefully help some of the physicians out to understand their patients a little better.
Oh, I love it. And so I'm curious, I know, not everybody is self-aware about their own internalized bias. I know, some of our OAC members we've talked to about, how they learned that. So how did that come up for you? Was it in therapy? Was it something that you just learned, or how did you identify that as being internalized bias?
Therapy certainly helped unpack a lot of that, but the Obesity Action Coalition really did help a lot with that too, as I learned more about obesity as a disease and their work with weight bias in society. I started to recognize too how I contributed to that in my own thinking. And it's even simple things like, if you think about if donuts come into the office, right? Common thing in a lot of offices. What goes through your head? Oh, well, I shouldn't have one. I had a treat last night. Or, oh, I need to announce that I'm only going to have half of one because I'm on a diet. Mm-hmm. Has anyone ever announced, like, you have to make a point of saying something because otherwise you feel like you're going to be judged either way, right? Or you have to take one when no one else is looking. Like, even the thought of thinking about strategies around donuts in the office is the experience of weight bias and trying to navigate a system of food and all of that without falling into being stigmatized by others and also stigmatizing yourself at the same time. Yeah. Anytime I catch myself using terms like I always do, or I never do, or I should be, or I shouldn't be, particularly around food or my body, it always raises a red flag that I need to be mindful that maybe I'm not thinking in a fully kind and compassionate way for myself. And what's interesting is our thoughts are often, they're just thoughts, but our first thoughts are those ones that have been trained by society. And so you can't necessarily eliminate the internalized bias in your head, right? There still will be those thoughts there. I've done a lot of work in trying to get rid of them. They don't disappear, but you can catch them and say, oh, that's the stigma talking. I don't need to listen to that thought. And you don't have to give it power anymore.
That's powerful.
Yeah.
So recognize, okay. And how do you think, trying to think about for the healthcare providers, how can they not contribute, to making that worse for somebody, or bring it up in a way that maybe is the first time someone hears that from a healthcare professional, like this is something that you could be experiencing?
It is so tricky for healthcare providers, and I do not envy them in the slightest. Unfortunately, so many people who live with obesity have real trauma responses going to the doctor because of the stigma that they faced by doctors and nurses. And it really is important to listen to our patients and understand where they're coming from, and then meet them where they're at first. So their goals may not be ultimately where a doctor will want them to end up, but we have to start with where a patient wants to go first, and we have to have them lead the conversation. Because if a patient, particularly a patient who's had bad experiences at the doctor, can't trust you with their own journey, knowing it's our journey, right? It's our bodies we're living in. It's our knees, it's our weight, it's our health. So a doctor has to acknowledge that it's the person's autonomy and choice first, and that they are there to provide information and care and support.
Oh, that's perfect. That's exactly what they need, but it's not what ends up happening. That almost that curiosity approach and that patient. I mean, people throw around patient-centered care, but I think true patient-centered care starts with that. And I mean, in my experience, one of the questions of just sort of a new patient or approaching a patient from this is a topic that has a lot of emotions, how can I do my best to meet you where you're at, to be sensitive, to use the correct terms, even with weighing practices. I've been thinking a lot about sort of the psychology of how we weigh people, and do we always need to, and especially people's comments about it. And, and even just, is weight and BMI a further stigmatizing thing when we have, other ways to talk about adiposity or body composition?
Yeah, absolutely. And does it need to happen first? Can it happen after a conversation if we need it? Because you don't always need it. And there are valid reasons to have it and valid reasons to monitor it, but it's not always the reason you're at the doctor either.
And you can really derail a conversation when that is done poorly.
Yeah. And, I can't count how many doctors I've had bring up my weight like it has never occurred to me that I struggle with obesity.
Mm.
As if I'm naive to the fact that I live in a larger body, as opposed to something that I'm aware of, hyper aware of every moment of my day.
Mm-hmm.
You know, and even the acknowledgement that we are aware of the bodies we live in, the conditions we have in, for the most part, you know, I mean, if it's not some strange blood work that's going to come back that we thought to do, we know what hurts, we know what feels off, we know if something has changed in our bodies, and we want to be listened to, you know, because if we've gone in because something now hurts that didn't used to hurt, it probably isn't because our weight is suddenly affecting something that wasn't it affecting it a week ago.
That's important. I think that's a really helpful frame for them to understand.
Yeah.
I think this is going to be a really eye-opening session for, I think, so many people. I'm really excited to be there with you and making eye contact from the front row with you.
You can bring a big old sign.
Yeah. So, well, and kind of wrapping up, and don't want to spoil the whole session. Any things that people who aren't at that meeting can take from your experience that would help them in their practice working with other patients.
You know, my big thing is let's put care in healthcare. I recognize that doctors and physicians are pressed for time. They see too many patients. They are under the gun to code things just properly and check the boxes. But remember that the patient in front of you isn't a box to check. It's our lives that we're living, and we live with obesity every day. And we are living with the effects of obesity, both internalized and from society every day as well. So walk with us or help us find someone who will, if you don't have the time to do so. But, remember, we are people first.
Oh, well, I have goosebumps. That was really, super powerful. Thank you so much for sharing your pre-story story with me. And I think this is going to be, a big focus at the meeting, and how, armed with some new tools in their toolbox, how they can, keep crafting their tools and put care in healthcare. I love that.
Yeah.
That's something that we can see in our lifetimes.
I'm so looking forward to it. It's going to be a wonderful time, and I love to share my story. So.
Oh, well, thank you, Liz. I really appreciate you being here with me.
Thanks, Nina.
All right. I'll see you in a couple weeks.
All right.